Do you know what breast cancer is and how it affects millions of women worldwide? It's more than just a disease. It's a significant global health concern. At its core, breast cancer is defined as the uncontrolled growth of abnormal cells within the breast tissues. These rogue cells can cluster together to form a mass or tumor, which can be either malignant, meaning cancerous, or benign, which is non-cancerous. Breast cancer is not just a disease, it's a global health concern that affects millions of women worldwide. But what causes breast cancer, and are there different types? Breast cancer arises from a multitude of factors. One key contributor is genetic mutations, changes in our DNA that disrupt the normal cell growth process. These mutations can be inherited from our parents or acquired over our lifetime due to environmental exposures or simply random errors during cell division. Another significant factor is hormonal influences. Estrogen, a hormone more prevalent in women, can stimulate the growth of breast cancer cells. This is why women are more likely to develop breast cancer, particularly those who started menstruating early or entered menopause late, as they are exposed to estrogen for a longer period. Environmental factors such as exposure to radiation or certain harmful chemicals can also increase the risk of breast cancer. Lifestyle choices, like excessive alcohol intake, lack of physical activity and obesity, are other contributing factors. Now let's delve into the different types of breast cancer. The most common type is ductal carcinoma in situ, or DCIS, which begins in the milk ducts. Then we have invasive ductal carcinoma, or IDC, which starts in the ducts but spreads to the surrounding breast tissue. Invasive lobular carcinoma, or ILC, originates in the milk-producing glands called lobules. There are also less common types, like inflammatory breast cancer, which is an aggressive form that often presents as a rash or inflammation on the breast. Understanding the causes and types of breast cancer can help us better prevent and treat this disease. How do doctors detect breast cancer? Well, there are a variety of diagnostic methods that doctors use to identify this condition. One of the most commonly employed techniques is a mammogram. This is a specialized X-ray of the breasts that can detect abnormalities often before they can be felt. Another method is an ultrasound, which uses sound waves to create detailed images of the breast tissue, helping doctors distinguish between solid masses and fluid-filled cysts. Then there's the MRI, or magnetic resonance imaging, which provides highly detailed images of the breast and is particularly useful in assessing the extent of the disease. Finally, a biopsy may be carried out where a small sample of breast tissue is removed and examined under a microscope for signs of cancer. These techniques, along with regular screenings, play a vital role in early detection of breast cancer, which is key. Early detection is crucial in the fight against breast cancer, leading to improved outcomes and survival rates. What are the signs and symptoms of breast cancer? This question is vital in the early detection and treatment of breast cancer. It's crucial to be familiar with the common signs and symptoms, which can vary significantly among individuals. One of the most common symptoms is the presence of a lump or thickening in the breast tissue. This lump is often painless, but it can sometimes cause discomfort. Changes in the breast size or shape can also signify breast cancer. The skin over the breast might appear dimpled, much like the skin of an orange. Breast cancer can also present itself through nipple abnormalities. The nipple may become inverted, or it may discharge a fluid that's not breast milk. Unusual breast pain that doesn't go away can also be a symptom. However, it's important to remember that some cases of breast cancer may not exhibit noticeable symptoms initially. Regular screenings and self-examinations are crucial. Being aware of these symptoms can lead to early detection and treatment of breast cancer. Let's recap what we've learned about breast cancer. It's the uncontrolled growth of abnormal cells in the breast, triggered by factors such as genetics, hormones, and lifestyle choices. There are different types, including DCIS, IDC, and ILC. Diagnostic methods like mammograms and biopsies help detect it, and early detection improves treatment outcomes. Symptoms may include lumps, changes in breast size or shape, and nipple abnormalities. Remember, knowledge is power. The more we understand about breast cancer, the better equipped we are to fight it.